Hey everyone, welcome to my YouTube channel. Thank you so much for joining me today. I'm Natalie Brooks, and I'm a licensed psychotherapist, and I'm also a clinical certified MBT supervisor. And for those of you who maybe missed the last video, I created this channel to help therapists struggling to grow their therapy practice without burning out in the process. And hopefully, while doing that, all at the same time, become a better therapist. Now, there's many channels out there that talk about the therapy business strategies, marketing, social media, and all that good stuff. And while those are super important, none of them really matter if clients aren't coming back, say, after the first, 1 to 4 sessions. So today I'm here to talk about client retention, why it's happening, and what you can do about it right now. So, and when I say right now, I mean in your next session. So let's get started. Um, First, I want to talk about what I mean by client retention. Now, I'm not talking about unethical practices of continuing sessions beyond what is beneficial for the client or pushing the client, in a very salesy kind of way. I'm not, that's not what I mean when I say client retention. What I do mean is that when a client comes, for the first, second, or third session, and that they're clearly in need of therapy based on the issues that they're presenting to you, whether it be in symptoms or situations or both. But they come for maybe 1 to 4 sessions, and then they either ghost you or they're suddenly better, right? They they suddenly don't need therapy anymore. So, in order to kind of address that, I think as a therapist who's worked in, you know, outpatient treatment programs as well as in private practice for many, many years, and working and supervising very, very complex clinical cases of, personality disorders and eating disorders, complex PTSD, et cetera, or some combination of all of them. I've heard kind of both sides, right? I've heard from, clients who may have come, found me, and maybe I was their third, fourth, or maybe even fifth therapist. And there's data out there that shows, I can't remember the study off the top of my head, but there's data out there that shows that, people diagnosed with personality disorders, um, specifically borderline personality disorder, they typically, on average, have gone through, I think it's six therapists over the course of their therapy experience. And so when you think about that, I think it's important to look at, obviously, for that specific population, but also for us as therapists to think about, even for those of us who maybe aren't seeing um, people with personality disorders, but maybe we're noticing, I can't really get past, 1 to 4 sessions, or maybe that's not always happening, but maybe it's happening, it's happened more than a couple of times, right? So when I think about that, there's a pattern there. Um, and I think it's important to pay attention to that pattern. And just like our clients, we don't want to keep repeating it, right? So the other thing that I've heard from therapists is they think that they're doing everything right, and most likely they are. Most therapists are not in this field, to cause harm, right? And we want we want to help people. We want to make a difference. And so there's a disconnect somewhere. And so today I'm going to talk about client retention, and the three things that I've heard, mostly, I mean, this is all from clients, but there's three things that I've heard over many, many years. And one is that the client doesn't feel understood. Now, that sounds pretty simple, right? But we'll get to that in a second. The second thing is that they felt judged. Um, And again, I know most therapists are well intended, and so even if you didn't say anything, you know, that was judgmental, this is a thing that I hear over and over again. And then the third thing I hear is a feeling that they have about you or the therapy process, and that it got in the way and that they didn't feel like they could bring it up with the therapist, which kind of goes back to the first two, right? So, in my work with other therapists and consulting to them, and also coming from a background of mentalization based treatment, I've thought about what you can do about it. And so the first one is there's three things off the top, right, that you can do today or in your next session. The first one is super simple, and but it's to be an ordinary human being, not an expert. Even if you are one, a client doesn't want to feel like they're talking to a professor or someone who's going to lecture them. And of course, we want to provide psychoeducation, but I've also, both in my personal life, but also hearing from clients, recognize that sometimes professionals, we use language, that we're all very, very familiar with. And so we use it, it's almost, it's become part of our daily vocabulary in some ways, right? And so we use language that we, again, not intentionally, but we assume that the client understands what we're talking about. And I see this all the time. So that, even though it sounds super simple about being an ordinary human being, I think it's really important that, yes, we're wearing a therapist hat, but we also, um, what I've noticed is that if we can view therapy as if, we're sitting on a park bench and talking to someone, that's a very different experience for the client. And I'm not talking about just chit chat, but I'm talking about the experience of being in the room, right? So of course you're going to get to those clinical situations, but the client wants to talk to a person, not a textbook. And so, moving on, the second thing is to be aware of your own judgments, and how you might unknowingly be transmitting some of them, even if you're not saying anything, right? So, you know, for example, body language, eye contact, looking away, holding your breath, uh, tone of voice, shifting or pausing, right? And you know, particularly with clients who have either personality disorder um, or border or personality structure, right? A challenge, that there's some personality disordered structure, right? They're not necessarily meeting criteria, but perhaps they're extremely rejection sensitive, or they're extremely uh, highly reactive, and easily quick to react and emotionally dysregulate. Those clients are very, very aware of the nonverbal cues that we may not even realize that we're giving them. And so that's number two. Number three is to not assume that you understand the meaning behind what a client is telling you. Now, of course, you understand the words. And I experience this with my clients all the time, right? That I might ask them, what they mean by something. And I'll qualify it by saying that I understand the definition of the word, but I want to know what it means for them. So let me give you an example. Um, so, for example, if a client uses the word traumatizing or anxiety, I don't assume that I know how they're experiencing those terms. right? I obviously know from a clinical perspective and just an ordinary dictionary perspective what those words mean, right? But the experience that a person is going to have is going to look different for everyone. So my experience of anxiety and your experience of anxiety are going to look different because we're two separate minds, right? And so as a clinician, it's super important to not assume that we know what they mean. And, you know, there's no two minds that are alike, and minds are opaque, right? We don't know for sure. We think, I mean, certainly there might be cues, both nonverbal and verbal, but until we really check it out with someone, we don't know, with 100% certainty, So I think, and why that relates, I think, to client, all three of these relate to client retention, is that in my experience, both again as a supervisor and also seeing clients for many years, I think we overlook some of the very basic things, and not intentionally. I think we take it for granted. And so, coming from a place of curiosity, simplifying and being a human, being with the client and not coming or sounding like, a textbook with, long explanations of why, interpretations of why you think they're doing what they're doing. And I'm not saying that those things are not important, that interventions are not important. Of course they are. But when we're first developing a connection with a client, and you might some might refer to it, of course, as developing a rapport, right? But you know, if we're getting the sense, if you're having the sense that you're developing a rapport with a client, but then they don't come back after, say, like I said, 1 to 4 sessions, and they clearly need, help, or they've expressed wanting help, and their symptoms present that they need help, but they're not coming back, and you feel like you're making a connection, something's amiss, and we need to look at that. As a therapist and figure out what it is that we might be, again, like I said, transmitting or assuming that we know something. There's some, again, it's not all our fault, of course, but there's some role that we're playing in it. And so I hope all of this was helpful. I'm going to keep building on my video series on ways to build your therapy practice, but also to help you become a better therapist. And again, all while not burning out in the process. So if you liked what you heard today, please make sure to subscribe and hit the like button. And again, thank you so much for joining me, and I'll see you in my next video.